What is the difference between psychopathy and sociopathy? Imagine two individuals who both break the law, but their reasons and behaviors are worlds apart. That's what we're here to explore today. When it comes to criminal psychology, understanding the difference between psychopathy and sociopathy can help explain why some offenders are more dangerous or harder to rehabilitate than others. These terms are often used interchangeably, but they actually refer to distinct patterns of personality traits and behavior. Psychopathy is usually seen as a personality disorder that someone is born with or develops very early in life. Psychopaths tend to be cold, calculating, and very controlled. They often lack empathy and genuine emotional feelings. They can manipulate others easily because they are superficial in their emotional responses. Their actions are usually planned and strategic, aiming to achieve their goals with minimal risk. They rarely show remorse or guilt, and they often view relationships as transactions. Their violence is often instrumental, meaning they use it as a tool to get what they want, not out of emotional impulse. Because of their ability to blend into society and their lack of emotional connection, they are often harder to spot and more dangerous. Sociopathy, on the other hand, is thought to be more influenced by environment and upbringing. It tends to develop after exposure to trauma, abuse, or neglect. Sociopaths usually have a weak or impaired conscience but are not completely devoid of it. They can form emotional attachments, but these are often unstable or dysfunctional. Their behavior is more impulsive and reactive, often triggered by emotional outbursts or frustration. Sociopaths are less calculated and more likely to act on impulse, taking risks without much planning. They may feel guilt or remorse after their actions, which makes their behavior somewhat more unpredictable. Their crimes are often spontaneous and driven by emotion rather than careful planning. From a criminal psychology perspective, these differences matter a lot. Psychopaths tend to be more dangerous because they are more calculated, less emotional, and more capable of committing complex crimes. They are often more difficult to catch and rehabilitate. Sociopaths may be more impulsive and reactive, which can make their crimes more obvious, but they are also more likely to respond to treatment or social intervention. Both conditions are classified under the broader diagnosis of antisocial personality disorder, but psychopathy is considered a more severe and specific form. Psychopaths often show traits like boldness, disinhibition, and a lack of empathy, which can lead to more violent and versatile criminal acts. Sociopaths may have trouble maintaining stable relationships and are more prone to emotional outbursts, which can sometimes make their criminal behavior more predictable. In the world of true crime and criminology, knowing these differences helps professionals profile offenders, assess risks, and develop better strategies for management. Psychopaths are often master manipulators who can hide their true nature, making them especially challenging for law enforcement. Sociopaths tend to be more visibly disturbed and impulsive, which can lead to different patterns of offending and detection. So, to sum it up, psychopathy is mostly innate, marked by emotional coldness and calculated behavior. Sociopathy is shaped more by environment, characterized by impulsiveness and emotional volatility. Psychopaths are generally more dangerous and harder to treat, while sociopaths may show some remorse and have more unstable social ties. Both are linked to antisocial personality disorder but differ in severity and how they show up in criminal behavior. Understanding these differences helps us better grasp why some offenders act the way they do and how to approach them in the criminal justice system.